All right, I'll kick it off. Welcome, everyone. If you're here for the Transportation Equity Task Force Lunch and Learn on the CTNA or the Community Transportation Needs Assessment, you're in the right place. I am Lisa Stedman. I'm with the Transportation Equity Task Force, or TREC, and I'll be the facilitator for today. Advocates Building Lasting Equality in New Hampshire, that's ABLE, New Hampshire, advocates for civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, inspiring communities, and influencing public policy. ABLE tries to do a really good job of hearing from its constituents and its members about the things that are most important to them. So we work on the topics that are really impactful to people, like housing and Medicaid and supportive education. And as of 2024, people were still asking us to work on transportation. And to that point, we just weren't ready to handle the mammoth project of tackling transportation. But we did form the Transportation Equity Task Force in 2024. And as the task force had its first couple of meetings, we decided that one of the biggest issues was that folks don't really know or understand the options that are already available out there for them. So we decided to come up with the Lunch and Learn series, and this has been going on for quite some time, over a year now. You're participating in the Lunch and Learn for this month, and they do happen at the same time every month. So in September, we're going to be talking about advocating for better transportation systems. And as we go along in the session for today, you'll understand why that is so important and hopefully be intrigued to participate in September. And then in October, we're going to talk about microtransit and how we can increase the availability of demand response in the state of New Hampshire. If you want to see any of our previous Lunch and Learns, you can see them on our archive. Those are links to the live events and also links to the one-pagers that are created from each of the sessions and the AI summaries as well. Today, we're going to talk about the Community Transportation Needs Assessment, the CTNA. This is really, really good timing because the final report just came out Tuesday of last week. And luckily, we had Lily lined up. We got her time on our schedules before she got super busy talking about these wonderful reports that just came out. Oh, Lily, I'm going to turn it over to you. And thank you for being here.
Thank you so much for having me. I'm really pleased to be here with you all today and to talk to you about the Community Transportation Needs Assessment. I think Lisa really set the stage when she said that transportation is really the 1,000-pound elephant, right? This is a really, really challenging topic and area for so many of us in New Hampshire. And solving for that is really not a one-man gig. It's going to take all of us working together to really solve for these transportation challenges. So I'm going to start today by telling you a little bit about the project we did. So I'm going to talk to you about the study that we have just wrapped up. This was a multi-year study that really dug into what are the transportation gaps in New Hampshire and how can we solve for those. And so before I get started on what it's going to, the data behind the report, I wanted to give you a brief overview of what you can expect from today. So we heard from a little over 2,700 individuals through survey results, through focus groups, and we made sure that we had representation from every county in the state. I'll be talking a little bit about the data that we found, some of our starkest findings, and then we're going to be talking about what this mobility transition means in numbers and stories. And then I will talk a little bit about the 6 recommendations that this action plan includes, because we didn't want to just talk about what are the current gaps in transportation. We wanted to really present this as an opportunity to solve for some of the challenges that we are all experiencing when it comes to community transportation. And then lastly, I'm going to wrap up by talking about what you can do as individuals, as groups, to move this work forward. Because truly, this report can help with that, but the report is just that. It's a report. People need to bring reports forward with their lived experience and to give some life to the data. So before I dive into the full report, I wanted to talk to you a little bit about what the commission is and how we came to this work. So the Commission on Aging was established in 2019, and our primary charge is to advise the governor and the general court on policy and planning related to aging in New Hampshire. And this is particularly relevant because you may or may not be aware that New Hampshire has the second oldest population by median age in the country. So that means that we are second to Maine and tied with Vermont for having the largest proportionality of our population that is older. And this matters because we need to study policy and planning related to aging so that we can reorient some of our systems to really be beneficial for an older population. So in acknowledgement of that shift, we have the commission, which is 26 members strong. One of those is a state senator. We have 2 state representatives, and we have 8 state agencies. That's a really important component of the commission because we work across state departments. How often do we hear of a story where there's a challenge in one place, but we don't close the feedback loop? And that's really essential for what the commission endeavors to do, which is to make sure that we aren't working in silos, that we're working across our state agencies. Outside of that, we also have 15 governor-appointed members. These are members that represent all of the 10 counties in the state. And there's just some information to the right about the proportion of our state that is over the age of 60. The census estimates as of, I think, last year are that we have just over 416,000 people that are over the age of 60. So a significant portion of our population. So this matters within the context of where we find ourselves in 2026. When we think about living a long and happy life, many of the public health decisions that we made got us to this point, which was to live a longer life. Now that we are living perhaps the longest that we've ever lived in human history, so just as an example, we've doubled our life expectancy since 1776, we can now expect to live a longer, healthier life. This requires us to reorient our systems around this increased longevity. A lot of our systems were put in place in the 1960s. I don't think much has remained the same in day-to-day life when we look at the 60s, right? The cost of everything is different. The infrastructure is different. Retirement age is different. So this means that we have to reorient our systems around our current longevity so that we're making sure to take care of ourselves as we have longer and longer lives. We can expect that the population of older adults, those who are 80 plus, will double by the year 2040. That's a significant statistic. If you look to the right of this slide, you'll see that this is a current age band of demographics in New Hampshire. So right now, 60% of what we call our older adult population fits within the 65 to 74 age frame. So the majority of quote unquote older adults in the state are in what we would call the younger age band. We then have 28% that are in the 75 to 84 range. And then we have 11% that are in that 85 plus. What is really important for the purposes of planning is to understand that while the largest portion of older adults is in that younger age band of 65 to 74, the fastest growing segment of that population is in the 85 plus. That's important for us to know for planning purposes because as we age, we can have an increase in some physical disability that may have us require to change some things about our home, about how we drive, about how we live our day-to-day lives. And so that's important for us to take into consideration. New Hampshire last summer became one of 11 states that now has more older adults than children. So The need is here. This is also not a temporary blip. So sometimes people say, well, when the boomer generation ages through, we'll go back and everything will be staggered in the same way it was before. And what we know from global statistics is that the global birth rate is declining. This means that we are not having as many children. And so we will skew towards an older population for decades to come. So that leads us to how the commission came to this work. We kept hearing the same story. As a commission, people would call us with challenges. We would go and we would have a meeting with the Department of Health and Human Services about how we could extend access to home and community-based services. And the conversation turned back to a ride. We would talk with medical providers about how we could get people to appointments, and it came back to needing a ride. Transportation was clearly central to how we were going to sustain longer independent lives. This also dovetailed with the work that the New Hampshire Alliance for Healthy Aging was doing. We work very closely with them in collaboration as stakeholders to understand the needs of an older population. And they have a transportation work group that was very interested in understanding the current gaps in our system for older adults and whether or not we could gather data that was specific to New Hampshire. And what that group highlighted was that we did not have data that was specific to just New Hampshire. We had some data from some regions that was robust, and we had some national data, but we didn't know how this was going to truly impact New Hampshire when we think about meeting the needs of transportation for an older population. So what does it mean when somebody says, I can no longer drive? What are they going to do? Where is the gap? What are the driving behaviors? Those were things that we didn't have answers to, which is where we came to understand that we really needed to have a better understanding of what we're facing as a state so that we can shift and meet population needs. So I'm going to dive into a little bit about what we found. Again, this was a robust process, multi-year, and a lot of the data that came out of this was from a specific survey that we had centered older adults. We centered adults living with disabilities and the veteran population. So they were oversampled purposefully in our survey because we wanted to report out specifically on those metrics. And what we found was that 42.8% of individuals who responded to our survey had missed or delayed or avoided medical care because of transportation in the last month. 60% of individuals had experienced some level of transportation insecurity, and 87% of them had never heard of the Keep New Hampshire Moving website, which is a transportation resource website. It's sort of a quasi-state supported entity that helps get people connected with their regional mobility managers and allows them to do a basic search for transportation resources in their area. What did the numbers say for older adults specifically? We found that 53% of people, almost 54, who took our survey were in the 65 plus category, and that 43.1% of them who were 65 and older had already started driving less. These are people that are already adapting their driving behavior because of their age. That could mean limiting driving at night, people that limit driving in snow or certain weather conditions, or maybe people avoid the highway or they avoid going to unfamiliar locations. 25.5% of these same older adults reported that they were not very confident driving themselves. This is perhaps, I think, one of the hardest data points for me to recognize, because if we don't have a transportation system that can adequately support somebody to give up driving, they have sometimes no other choice but to continue to drive themselves so they can access medical care, groceries, prescriptions. And that's a challenging statistic to see. We know that transportation is more than just medical care, right? It is social isolation. And we saw this a lot with our work having to do with Age Well NH, which is our proposed multi-sector plan on aging. And when we went out into the community and started talking with providers, we heard time and time again that in post-COVID era, people still were not socializing. People were still very socially isolated. We saw this the most pronounced, which I suppose is not surprising given its northern part of the state, was that Coos County had almost 60% of people reported feeling stuck at home in the last 30 days. So the counties that are represented here, Belknap County at 58.4% and Grafton County were higher than the statewide average, which was still significantly high at 44.5%. So we know that social isolation is a large determinant of health. There's a lot of interesting statistics out there about social isolation and loneliness equates to smoking 10 to 15 cigarettes a day. It has really extensive implications on your physical health as well as your mental health. Perhaps the sharpest finding from the study was that 67.6% of working age adults with disabilities missed, delayed, or avoided medical care because of transportation. That is a huge number of people that are missing medical care because they can't get there. And it's also indicating, this was far more, by the way, than older adults who are 65 plus. So when you compare those numbers on the right, older adults were at 36.4% compared to the 67.6%. It's showing that the system is not able to adequately meet the needs, which I'm sure is not surprising to most people in this group who've experienced that, right? The system is not meeting the needs of the youngest parts of our population that are experiencing or living with a disability. That could be for a variety of reasons. It could be information. It could be there's simply no access for that group. It could be that there's theoretical access on a map, but the transportation that physically exists isn't adequate for paratransit or some of the needs that someone might have getting in or out of a vehicle. So this is a signal that the system is not able to adequately provide for working age adults. To me, it also signals that there's an opportunity here. All of this with a challenge comes with the opportunity that these are working aged individuals who may very well want to work, but cannot get to a place of employment. So there's an opportunity to connect people with transportation. It could open doors to building our workforce. This leads us to what we discovered and what we're calling a mobility curve, which was that the highest degree of transportation insecurity was in the youngest band of individuals living with a disability, and that number decreased as people aged, but then started to curve back up as people aged, right? So you can see on the left, we have that 68.2, and then on the far right, we have 38.5%. So then as we age, we talked earlier about people as they age are more likely to report a disability, that there's a curve that's happening, and that the system that is designed should be able to meet both ends of that curve. It should be able to meet the needs of the working age disabled adult and also the needs of the 80 plus individual living with a disability. 78.3% of the people that took our survey who were over the age of 80 reported at least one disability. So this was, we mapped out each region of the state based on mobility management. So there's regions of the state that have to do with mobility. And we wanted to understand what was the proportionality or relationship between what we call a transit desert, which is in definition terms, the portionality of the area that doesn't have any transportation, right? So you can see at the top of this, we have Sullivan County, where it has a high degree of the area is a transit desert. You can't get there from here. And we wanted to understand the relationship between how much of it was a transit desert and the rates of reported insecurity in the working age adults with disabilities population. And so each area, it depicts the relationship between the transit desert and then that transportation security or insecurity measure. It's important to note that for Carroll County, we were not able to back into that number because we had less respondents from that area as a whole, in terms of the whole population, but in terms of the number of adults living with a disability, that number was too small to quantify to have it be validated. That does not mean that there wasn't a stark contrast between those two numbers. And sometimes you can see that the relationship makes sense. In Sullivan County, there's a large portion of that area that is a transit desert, and there's a high degree of insecurity. That makes sense, right? People can't get from point A to point B. Where it starts to make less sense and makes a strong case for why we need to fix the system is in a place like Greater Nashua. There's theoretical access. People are still not able to get where they need to go. The system's not supporting the working age adults who are living with a disability. And so we're calling that the trap in the map, is that sometimes you can have really good coverage on paper. We see this in Coos County, where we have Tri-County Transit is doing real work. They are covering 16 out of 20 towns. I mean, that's pretty robust coverage, and people are still experiencing significant barriers to getting where they need to go. That could be that where they need to go is quite a distance because they're living in a more rural area of the state. So it could be that they're traveling further for medical care. We heard some very troubling stories about individuals who, because of Medicare coverage, needed to have an in-person appointment to get on in-home hospice and couldn't make the hour-long trip, couldn't find transportation to get to the doctor's appointment so they could utilize their insurance so they could die peacefully at home. And we have to fix for that. We have to fix for that. Carroll County, we had a similar situation where only 44% of it is considered a desert. So when you compare that to the rest of the state, that would be considered moderate. And they had 60.6 insecurity rates. So again, a difference between where there's theoretical coverage and people are still challenged with getting where they need to go. I wish that this report came with a bag of funding to make the changes that are necessary, but the report doesn't come with funding. It comes with the data that will help people to understand what this system is already costing us when we can't get where we need to go. We wanted to really understand, when we fix nothing, what does it cost us? Because there's a cost involved with that. It's not just personal. It also comes back to impacting systems and funding. And so what we know is that of the individuals who took the survey, there were over 1,400 missed appointments in a 30-month time span. That is a significant number of missed appointments within medical systems. There's a cost to that. We know that this cost people just who reported missing work $105,000 of missed wages in a single month. Those are workers who would be solving some of our workforce crisis issues, but they can't get to where they need to go. We also know that this is costing an average annualized cost for healthcare spending for missed medical care of somewhere in the realm of $4.3 million. Because when somebody misses a medical appointment, it can exacerbate physical conditions. If you're living with multiple chronic conditions and you're putting off the care that you need because you can't get there, there's a cost further down the line, whether it's repeated hospitalizations or an exacerbation of your symptoms that mean you need more medications or more intervention, or worst case scenario, you need to then go into long-term care, which is roughly $150,000 a year. We also know that it's costing us in retail spending. There are individuals who would like to go out into their communities and support small businesses. They would spend money in retail shops, in restaurants, at a pharmacy, at a grocery store, but they can't get there to spend the funding and keep it local. What was missing and what now exists, we did not have standardized definitions. So there was no definition of transit desert, and we've now coined that term so that we can apply it and understand what that means across the state. We didn't have baseline data. We didn't know how significant these challenges were, and we didn't know how they played out across counties and service areas. And now we have that data. We knew that there were 116 federal programs that funded transportation in the state across 9 different agencies, but we didn't know the extent to where that coordination fell off. What we now know is that there's not one entity in the state that is in charge or empowered with understanding how transportation works in the state. And we now know that 87% of people don't know about how they can empower themselves to look up information about how to get where they need to go with the Keep New Hampshire Moving website. So we have this baseline now, and that's what is the biggest takeaway from the data is that we have this baseline that can then be tested year over year to understand if an intervention moved a needle. So the Transportation Security Index is a validated 6-item measure. It is not a homemade metric, and it can be applied across each region. So for instance, a regional coordinating council can rerun that and see if its region year over year has changed its transportation security measures. Has our transportation security dropped? Are we meeting needs because we added a bus route or because we were able to recruit 10 additional volunteer drivers? This will make sure that we can understand that what interventions worked in what area and how can we equitably distribute some funding that comes into the state to understand which areas need more funding because people are missing more rides or what segments of the population need help more. So now we get to the fun stuff, which was we had the data that was in front of us, but what we wanted to understand was how could we fix the system if it wasn't currently meeting our needs? And I won't go through all of these. Like I mentioned, these are all on our website. I will link to those later. But I think the number one recommendation that we kept coming back to was there is not one single entity in the state that answers to the transportation challenge. You have multiple federal funding streams that are going across state agencies. And because of that, and because of the complexity of federal funding, you have people that are duplicating some degree of work, and then you have contractors who are feeling that on the back end. And so our recommendation is that there should be an interdepartmental office that should be in charge of managing all needs for the state so that we can work on our recommendation 6, which is to make the money work like one system. Nothing was designed to work together. It's all designed in some ways to work separately. And we need to have a much more integrated system so that we aren't running an empty bus back and forth because it's only there to serve a certain segment of a population. How can we fill that bus and make sure that it's meeting everyone's needs for all stages of life? We also need to adopt essential access standards and close the biggest trip gaps, including return trips. If I book a ride to the eye doctor for a glaucoma shot, I should be able to get a ride home. That should just be a standardized baseline. Same goes for if I need a ramp because I am in a wheelchair, then that should be a built-in standard that is provided, and I don't have to worry about the wrong car showing up with the wrong size ramp. So those are just some basics as part of our recommendation. We need to do a better job to make the website a true starting point. And we need to put everybody at the same table so that we can have some shared decision-making about how transportation impacts different groups across the state. So our next steps, use the data that's in CTNA. It's over 100 pages. There's a data companion workbook. It is also many, many pages long that breaks down subsections of the population that we measured. And it's the math behind how we got to the numbers we did. It's the methodology. Use the data, use it in grants, use it in testimony, use it to make the case for why we need a different system. You can stay connected to the Commission's work. We have a newsletter that we try to put out monthly. We have meetings typically 9 months out of the year. You can get involved in your local regional coordinating council or the statewide coordinating council. You can get involved in AHA, which is New Hampshire's Alliance for Healthy Aging. And you can carry volunteer driver programs as a real budget priority coming into this next biennium They are carrying a lot of the load for our current transportation system in the state. And just one final thought that I have on the next few slides is that a reminder that reports don't open doors, people do. You're the influence behind connecting people with data, pointing people to, yes, the situation is intense. Yes, the challenges are real, but there's a plan that could be implemented that could impact some change. Because it's so often when we have big, hairy problems, we get really lost in the details of it's too big to fix. We have to orient people back to there are things we can do that support everybody at every life stage to address these challenges. So a little bit about what the commission is going to do next to kind of meet some of these challenges and meet the moment. These recommendations will live on in AgeWell NH, which is our proposed master plan on aging for New Hampshire. That is a tool. It's often called a master plan or a multi-sector plan that a lot of states across the country are using in recognition of this demographic shift and in recognition that many of our systems were set up for a very different time. If we live in New England, not often do we live in a house that was built in this century, right? So what are the things we have to think about when we think about aging in our homes? If I'm 85 and I'm still lifting my air conditioner to put it up into a window, what do I have to think about in terms of planning so that I know how to take care of myself and I can stay independent in my own home as I age? So these are some of the questions that we're trying to use this document and this project to plan for. Things like housing, adaptable, one floor, zero-step entry housing. And transportation is one of those that's really central to independence. We are meeting with state agencies, legislators, municipalities to present this data so that everybody has the same playbook and the same understanding of where we're at in terms of our baseline. We're going to work to align and map goals across existing systems. There is not an absence of plans, right? If you've been around the state for a while, you can really get lost in some acronym soup around there's the state plan on aging, which is a federal requirement. There's the state plan on independent living. There's the 10-year transportation plan, the highway safety plan, the state health improvement plan. And what do all these things have in common? They all talk about the fact that we're going to have, and they commit us to, community transportation. What are the definitions of that across plans and who's going to do what so that we have some alignment and we have an efficient approach so we aren't just solving for things in a vacuum. So that's a really important part of our next steps. How are we going to work with our partners and stakeholders, our friends from AHA who have their own transportation goals to make sure that we are moving the ball forward in a way that is efficient and in alignment? We're going to collaborate with the Go North team, which is for the Rural Health Transformation Fund. How are we going to utilize some of that federal funding to meet this really challenging need of transportation, particularly in rural areas of the state? And we're going to assess how we share individual stories. We, in this work, had access to people that shared their lived experience, and it was really hard to hear of the challenges of people who have given up. A gentleman who has said, I'm not doing dialysis anymore. I'm going to just choose to die because I can't deal with it anymore. I can't deal with the transportation challenges of trying to get to dialysis. Those stories live in our hearts and minds, and we want to share them in a way that's impactful and respectful. And so really walking this line between how do we share the real human cost of what transportation challenges mean for some of our most vulnerable citizens while also honoring their lived experience. So those are just some of the ways that we're going to carry this work forward. And in that, it's important to know that this project isn't just the end. It isn't just that we've published the report. It's the beginning, truly. There's now this body of evidence that says this is the extent of the challenge we faced, and here are some ways that we can move forward together to solve for it. So I do have some links, and I'm going to click on the links so that you can familiarize yourself with what it looks like when you click on the link. So the first link I have is the Getting There Together. This is the full CTNA report. This is what it looks like. It's 112 pages long. It has the data that got us to where we made these 6 recommendations. And it has a wealth of information. You could come back to this and find different pieces of information every single time you went back to the report. I'm going to stop sharing so that I can share the next one, which is the Data Companion Workbook. What's super handy about this is that if you wanted to drill down into one segment of the population, the companion workbook, it makes that easier to do. If you wanted to look at veteran statistics or working age adults with disabilities or older adults, it's broken out by segment. So that makes it a little bit easier. Okay. So again, this is it, and it also walks through the headline statistics that exist in the Getting There Together report so that everybody knows how we came to those numbers. And then we have a county profiles document that lets you look at your individual county compared to statewide levels. So you can compare kind of apples to apples in terms of where your area fits compared to state averages when it comes to that transportation security or insecurity measure. So if you go to our website, if you just Google New Hampshire Commission on Aging, it's right there. And you go a little bit past the first paragraph that I'm required to have. You'll see there's a posting there that has a link to these 3 documents. And just a little bit of a note about the links. People might ask, why is the layout of some of this, like for instance, the county profiles, why does it look like this? These were all done to be accessible. Each of the documents on our website should be fully accessible for screen readers. And so sometimes that means that things look a little different. So that is my presentation. I'm happy to take any questions or walk through anything with anybody that might have that.
Thank you so much, Lily. So those of you who have been here before, you know that we share a closing survey, and I'm gonna keep this up while we do the question and answer portion of our session. Creighton's gonna allow everyone to unmute yourselves if you want to ask a question. We're also watching for hands that are raised. Please do answer this closing survey if you have an opportunity, because it lets us know what you want to hear about in the future, and so we can keep our content pointed at the needs of the community. Kelly.
Yes, you had mentioned Nashua. I happen to live in Nashua, so what's the problem in Nashua? I take the bus occasionally, but I do use Lyft, and I prefer Lyft to Uber because I'm a woman and you can request a female driver, not that you're guaranteed to get one. So I was just wondering what the problem is in Nashua. I know there's like a bus line and I could get from Nashua to Manchester, and then if I wanted to go to Concord, I could get a bus from Manchester to Concord, but it takes a really long time, and also the bus that goes to Manchester is only every 2 hours. Like I'm a member of the Autism Council, if I wanted to go to that meeting in person. So it's kind of complicated, and it takes a long time to get from point A to point B. That's my question.
Well, I think you really hit the nail on the head with that. I think that what we saw was that while there's theoretical coverage, right? People can theoretically get where they want to go maybe on the bus, but it's every 2 hours, or maybe they can't get from point A to point B. They can't get exactly where they need to go. And that sometimes this is more anecdotal than it is analytical, but in a system or a place like Nashua, you might say, oh, there's a bus, or oh, there's public transportation, so we don't need a volunteer driver program, or we don't need, fill in the blank. And there's an over-reliance or an over-assumption that people can get where they need to go because there's a bus, right? I live in Concord, and when I went to the Keep New Hampshire Moving website and I tried to look at my options in Concord for public transit, which are fairly robust compared to some areas, the first thing that came up was Concord coach lines. Well, unless I'm going to Logan, unless I'm going to Boston, that's really not going to help me get where I need to go in Concord.
Exactly. I went to New Hampshire, Keeping New Hampshire Moving, and I was like, how do I get from Manchester to Concord? It says there is no way. It's
Right.
there. I'm like, there isn't a way. I know there's a way, but it's not on the New Hampshire moving site. I'm like, because it said mid-state or something, and it said there's no options from Manchester to Concord. I'm like, there must be a bus. I thought there was. Maybe there's not.
All right, we've got lots of other questions coming up. And Noah, did you want to ask the one that you put into the chat?
Absolutely. Um, this was great. So my question is really kind of building off the previous question. How much of the data from the assessment shows that the limitation on or people feeling like their needs aren't being met are a function of not being aware that services exist, that the volunteer driver programs might exist in their region, that maybe there is some limited public transit, and how much of it is really or did you look at that breakdown in terms of the awareness factor versus the actual how far the network actually extends, the frequency of service, the availability of drivers?
Great question. I think that's maybe like the $1 million question, right? We could sit in a room and maybe study that for a long time and still come up with different answers. I think it's probably a combination of all the above, right? It's people who don't have an awareness, people who do have an awareness, but the transportation services that they currently have available to them can't meet their need, either because of age. That seems to be a frequent challenge for the younger working age adults living with a disability. And I think that we also heard anecdotally again and again and again that once people reach a barrier, if they've reached their threshold for that barrier, they give up. So if you've interacted with Medicaid transportation and you've had one bad experience, you got stranded at the dentist and you got stuck and you had to overdraw your bank account to get an Uber home, you're never calling that resource again because you had a bad experience.
Thank you. Lori with an IE was next.
Yes, I'm a selectman in a small town, and we have an agency that does transportation for us, and they've submitted their numbers for the next year, and it's gone from $17,000 to $47,000 for the services they provide. When we asked to drill down on the numbers, it was approximately 500 trips, but of course, those are one-way trips, which means it's really about 250 trips. And when we asked how many people that was serving, it comes down to 10 or 12 individuals. And it's really hard as a selectman to say, first of all, we're working on a default budget. So to come up with something that is such a dramatic increase for the benefit of 12 people in our community who I don't doubt desperately need that service. I suspect one is a dialysis patient who's got to go a couple times a week. But it's a real challenge for us to allocate that kind of funding. But when we asked the transportation company, well, have you gone to any of the medical facilities that you routinely transport to? We've had such a huge growth of medical facilities in the southern New Hampshire area. Have you gone to any of them? Because that's who you're bringing their customers. And they've said, no, we really haven't. And I guess I'm frustrated by the lack of creativity on the part. There's got to be money in those hospital systems and then those medical systems to supplement some of this.
Yeah, I think that it's an ongoing conversation, right? Where we have to have conversations within all of our systems, right? How are we getting people to medical appointments? There's a cost when people miss the medical appointments. And there are examples across the state of regions that have had really robust partnerships with some of those medical systems. Some systems used to provide some of their own transportation. As funding streams get cut, that becomes harder and harder. But I think, in challenging times, I think there's no bad ideas. We have to kind of put everything on paper and say, what is going to be the most efficient way to get and serve those 10 to 12 people? Is it partnering with another town's volunteer driver program? Maybe there already is one and we can expand it to this area. Right?
Yes, we're looking into that. Your report could not have come at a better time, I have to say, because it's really providing a lot of insight into the larger system. It's just hoping that someone at the top is going to be picking up the ball to make your action steps happen. So thank you so much for the work that went into this.
Absolutely.
And Lori, I will also say that the rural hospitals are struggling, and that's the reason that we have the rural health transformation grants coming into the states. And here in New Hampshire, we call that the Go North money. It's yet to be distributed for many purposes, but when it is distributed, we're hopeful that a lot of that will go toward the hospital's need and self-interest in getting people to the appointments. We're hoping they will put money that's designated to them toward transportation. Andrew.
I was mostly going to respond to an earlier comment, but I am kind of curious about something. Mostly, the previous speaker. I'm curious, what area are you working with? Are you working with the Regional Coordinating Council?
It's really something that has sort of just come up to us. So we haven't worked with any of the regional structures yet. We have a volunteer transport service just to get an idea of what that being at more regional suggestions in the teeth.
Sure.
And I am going to take Terry Palmer's question now.
Thank you, Lisa, and thank you everyone for joining this. I'm sorry I was a little bit late today, but Lori, Andrew was touching on, making sure that you're reaching out to your Regional Coordination Council, your mobility manager, because those folks can really get you in touch with the right people to talk to. If the agency is raising the amounts from $17,000 to $47,000, I would think that they should have given you an explanation as to why everything is going up. And but we all know that fuel, the price of the vehicles, so on and so forth is just skyrocketing. The cost of a trip is just astronomical right now. And so like Andrew said, start with your RCC, talk about coordination. There was another comment in the chat too about services in the Hillsborough Antrim, Hillsborough Antrim area. Same thing, Karen. Reach out to your RCC. There is service through Concord Area Transit in the Hillsborough area. Reaching out to that executive director or transit director, or whatever Terry's title is, and just saying, hey, we're looking for transportation. Is there anything that you can help us with? Maybe they only have transportation a few days a week. Maybe that's something you can talk to them about, expansion or what areas they would service. So the transit agencies in New Hampshire, if they are able to, are willing to coordinate and expand. It's just unfortunately sometimes the cost, they just can't. But having these conversations is a good start to the coordination piece that in Lily's presentation, I'm sure she talked about. We can do a much better job, and we're getting there. It's going to take time. It's not something that we can snap our fingers and make it happen. But we have a great solid base, and I'm super excited to see where New Hampshire goes in the future. So thank you, Lisa.
Laura, you're next.
Hi. There's like 2 or 3 different locations in New Hampshire that I have to go to Boston to get to. I'm going to a charity walk in Maine, and I have to go to Boston to get to Maine, which I really want to go to. It's a new walk for my medical condition. And, so I'm staying overnight because I can't get back in the same day. One of the bus drivers drove away and he didn't switch the sign on the thing. So I missed my bus, not thinking it was my bus. It was another bus. And I missed a whole entire date in Boston with a really dear friend of mine before a concert I was going to. So those little things and I ride the bus all the time. It's definitely not going to keep me from the next bus ride. But those little things, because I had to wait like a few hours before the next bus to Londonderry to get to Boston, because there's no more bus from Manchester in the middle of the day. The earliest one is 3:30. Those kinds of things really affect me
Thank you. Thank you so much that you've told your stories to us. I've heard your stories. We've shared your stories with your regional coordination council. And also, I remember that you spoke at one of the listening sessions when they were gathering data for the CTNA. So these are the things that Lily's talking about when she has all of these really compelling stories and she wants to do justice to them and share information. And yet it's your story to tell. In our next session, we'll talk about how we can be advocates and share our stories and to use that information to make the biggest impact. So I'm going to move on and share the rest of my slides and wrap this up. I do want to just acknowledge before we go that we have another session, September 18th, on making our voices heard, telling our stories, how we can be better advocates, how we can cause some tension, share this data, and make some movement in a positive direction. We would encourage you to become an Able New Hampshire member if this work is meaningful to you. We have Creighton working in the background to help us out with the chat box and also with managing the audience. We're very grateful for that, and we wouldn't have that if it wasn't for Able New Hampshire members supporting the work. So thank you very much.